Kick back with Jack McAdoo.
Real talk
with J Mac. What's happening, everybody? Man, I hope you guys are doing well. It's been a week. It's been like a week of energy and energy shifts for everyone. In my last two shows, I kind of went to this one place that I used to go where I had thoughts on everything. And the response to those have been really, really good. So I appreciate everyone that got in touch. And yeah. But anyway, my last show, I talked about different modalities, and I mentioned Sedona Photon Light and that I was going to have them on the show. I actually have Bill Savage. He is the owner, CEO of Sedona Photon Light. We're going to talk about some of the different modalities and healings and treatments that are offered there that, if you're in Sedona, you should probably check this out. I would really encourage it. If you are feeling, some pain, joint pain, cancer, different things. There's different treatments that they have. So what's happening, Bill?
Hey, Jack. Thanks for having me on today. Hope you're well.
Doing well. Sitting here getting levels together. Yeah, I mentioned Sedona Photon Light. I know it's been there for years, different ownerships. But same principles, same, when I say ownerships, I mean everybody is friends. One person takes over and, just keeps going. But I mentioned, I think I mentioned, if I didn't, I'll do it now, was the Photon Genius, I guess, which is the flagship of Sedona Photon Light.
Correct.
Moreover, it's one of the world's most advanced frequency delivering infrared saunas. You want to talk about that? Because, we have different healing modalities, on the planet, and everyone is always going to traditional, medicine, which, I'm not going to, we all do, for certain things we end up having to do that. But this is one of the alternative modalities of therapy. So, and I know you do, several of them. There's Photon Genius, there's the Photon Genius wands, which we'll talk about, sound healing, sound bed, and the Rife machine, which we'll get into as well. So welcome, brother. Again, welcome.
Thank you. Much, much appreciated. And like I said, there's no shortage of wonderful methods, modalities, and things out there to help us achieve, greater health and vitality outside, the big pharma model. And,
right.
And these are non-invasive and quite pleasant most of the time.
Right.
And and it gives you the ability to connect with a lot of other people on similar paths as well. So, on the technology side of it, you mentioned the Photon Genius Super Sauna, which is, you're correct, our flagship modality. A fellow by the name of Ed Skilling, who's passed on now, developed this device. It's about 59 years worth of work that has gone into this, and is probably the most advanced electromedicine device in existence today. He picked up where Dr. Raymond Royal Rife left off.
Mm-hmm.
You mentioned my Rife machine, my frequency generator. Royal Rife, for those who don't know, was the grandfather of frequency as a medicine. And around the same time, on the other side of the pond, Nikola Tesla was working on the same concept, just through magnetic resonance. But the goal was the same. It was, how do we affect the human body in a positive way using frequency? Because Rife was able, under heavy microscopy from a very special microscope he built, see pathogens and microorganisms in their live state, and then direct frequency to them to understand, well, what frequency did they resonate at?
Right.
So that we can, stimulate something into growth that we want, an immune system, or devitalize a pathogen or a virus.
See,
so
I, I, I,
What
I I'm sorry. We have a delay, by the way. It's Sedona, Atlanta. I was going to say I got to use this when I was in Sedona. I actually have a practice there as well within Sedona Photon Light. So this isn't like a infomercial, but I got to use it. And I remember when I was first using it, and I've used it years ago, and in and out, in and out. I was like, oh, okay, this. And then the last time I was there, I got to experience almost on a daily basis. And I remember telling you, for the first few times, I wasn't even sweating. Because if you're to imagine this, you can go to SedonaPhotonLight.com and check this out. But if you were to imagine, it looks like a stand-up tanning bed, half moon. And you go and it's got different color rainbow lights and everything. And you stand there and you go for, I believe, 10-minute intervals at certain levels. And it's hot. And you're supposed to sweat. And I remember the first few times I didn't sweat. But you always said, no, you got to keep going. You got to keep going. And I went and I finally began to sweat. And it's an interesting thing because you can actually feel energy flowing, different frequencies. They're subtle, but, you will feel it. And I noticed there's a different smell. It's not just normal sweat. It's almost like there's chemicals coming out of your body.
right?
Yeah. And I guess it's releasing the toxins, and it's the frequencies that begin to do the treatment while you're going through that, while you're releasing toxins and everything. The rest of it is treatment, correct?
Right. So what's happening is all of the frequencies are being delivered, and the heat. We know there's a lot of benefit to infrared heat, and we use near, far, and mid infrared, and so the heat really acts as a vehicle. And a delivery vehicle and an extraction vehicle, in addition to the benefits it presents. So one of the brilliances Ed figured out was, all right, we're going to use the heat to carry these frequencies deep into the tissues in the body. We heat you from the inside out. That's why, as you'll recall, you start with a higher heat setting, right? And then I had to turn it down in 10-minute increments because we want to heat you from the inside out. And by doing that, we're delivering the frequencies and the heat, causing the release of the toxins and a harmonic alignment of all of the inert noble gases in your body, which are made up of all the elements of the earth that exist in our body, which we learned from Dr. Russell back in the turn of the 20th century. And so as that normalization is beginning to happen, things need to leave the body that are in excess or shouldn't be there. And so as we heat you from the inside out, it acts sort of like a squeegee. And so we heat you up to the core, and then we start drawing that heat out and heating the mid-range tissue and then the closer tissue. And over time, like you notice, you start to create that sweating. That's our lymphatic system kicking on and doing its job. Our skin's the biggest organ on our body, and it's a critical part of the lymphatic system. Our kidneys process toxins, but so does our skin. It helps take pressure. When you can get to that point of sweating regularly, we're now taking pressure off the kidneys to do all the work.
It's almost like
push it all out.
It's almost like a microwave. The microwave uses different frequency waves to heat from the inside.
Exactly.
I don't know if a lot of people know that a microwave doesn't just heat your food. It starts from the outside and then works itself out. Yeah. So it's all about frequency. And
it is.
And you have the Photon Genie wands as well, and there's pads, and I've used those too. Those are amazing, everyone. They're two wands that you hold in your hand, and you will get the shock of your life if need be. But it works. But it works on the same premise, though, right? Because I remember when I was having pain in my hand, pain in my thumb, I would hold the wands, and with me, I was able to build up a tolerance to the frequency. And when I say frequency, everyone, it's more like an electrical charge. So it's like putting a 9-volt battery to your tongue on steroids, but it's in your hand, and the frequency can be controlled, by how much you increase or decrease. And it worked for my thumb. I had injured it a long time ago. It was always giving me pain, but I could hold the wands in my hands and through the frequencies and everything else, the pain would actually subside. You could smell ozone. And the thing is every time it pulsed, I remember telling you, it would pulse all the way up my arm, which was very,
everybody's different with the way they feel the intensity of that stimulus. And And we gauge, like I said, you can turn it up or down so that it's comfortable. I said, well, this isn't an endurance thing here. We want you to say, in an electric chair.
I was in it for the endurance, brother.
Some of you people are. And I should be looking in the mirror as I say that. But yeah, and everybody feels it differently. Some people just in a really low setting, man, they can feel it coursing all through their body, and others, they're up at max going, yeah, I'm mildly aware of something going on.
Now this is it's not, I mean, I know it's not the same concept because you're not building heat. You're not heating from the inside. So this is almost, would this be something like targeted treatment with the wand? It's
sort of in between. This was actually, the Genie was Ed's first product, and I've got one of the very first ones produced on display here in the front area there, as you saw. And so what it does is, like you mentioned, create the ozone. That's one of the primary components to this when you're holding the glass wand, is to cause your body to start producing oxygen, producing the ozone. And you smelled it, you started to smell it. And, we start with the hands because, one, it's the most sensitive part of the body, but also all the blood in our body flows through our hands every 3 to 5 minutes, depending on the person, their blood flow, and that kind of thing.
Right.
So after 5 minutes of holding those wands, you've begun oxygenating your blood. From there, as I probably told you, you can go to your carotid arteries, lymph. You can put those glass wands anywhere on your body you want. You've got a pain point. You've got an organ that's challenged. You've got growth you want to address. You can put those wands there. And then what's also going on is those foot pads. Remember, you had you put your feet on those pads. They're emitting, sort of like the Genius, they're emitting all of the frequencies. They're running through a program and randomly sort of packaging all of the different frequencies and putting them through your body. And when you're holding the glass wand, it helps complete a circuit as well as creating that ozone thing. And it begins some noble gas normalization.
How does, I don't know, what does Western medicine look at this? Now I know with Western medicine, it's all science and different things like that. And a lot of physicians that don't subscribe to these things will bitch and say, that shit doesn't work. This shit doesn't work. We need to give you a fucking pill. You know what I mean? Or we need to take an MRI and see what else we can dose you with to forget the pain. Have any physicians kind of crossed over to this? And I got to say this too, with this, I am talking to Bill. He is the CEO owner of Sedona Photon Light. He offers treatment modalities. I am no way, and Bill is no way in saying that, we're not proclaiming that everybody is healed with something like that. This is just an alternative form of treatment. If you want to check with your physician, go for it. There's no claims being made here or anything like that, except me as a person that has used everything that we're talking about. It did do well for me, but I did want to say that. So with physicians, are there more coming on board with this? Are they still really skeptical? I mean, where is this going? Because I know with Rife frequency, which this is, plus you have a Rife machine, which is, we'll get into, that machine is absolutely amazing. What are physicians saying?
I guess it depends on what country you're talking about. Number one, which I live in the U.S. as a global nomad and someone who's lived abroad for roughly half my adult life. It's interesting here in the U.S. For the most part, they're still very, very resistant, and I would attribute that to the financial component. The average med student is graduating with $500,000 in debt,
right?
And so. And then Big Pharma, of course, they come in and, hey, this was between licensing and the money, this is the education and this is what you'll do. And so they're not being educated in anything but what Big Pharma wants them educated in, which is read this list, give them a pill for this.
Right.
So they've not been afforded the education beyond what we've been doing for decades and decades and decades. Then when you go to the other side of the pond into Central and Eastern Europe, I've got friends over there in Poland and the Czech Republic and places like this, and even in Germany, where for decades, and some of the scalar technology, which is, people are becoming more familiar with that, was developed out of Russia a long time ago. There's entire, very impressive clinics and hospitals over there that use no Big Pharma.
Right.
it's all this kind of stuff, frequency and oxygen and non-invasive, non-pharmaceutical products. It's mainstream over there.
Mm-hmm.
And instead of an MRI, there's still a place and a time for that at times, but a lot of times the scanning and the tools for diagnosis are also non-invasive and very robust. When you look at bioresonance scanning as an example,
right.
There are several companies that produce these machines off Scalar technology. They can look at the deepest levels in the body and look at a broad range of things. It's still a snapshot, but it's a much more robust snapshot. It's very easy, affordable, non-invasive to be able to do a lot more of those snapshots to look for those trends that we need to find. Mm-hmm. in when something's going on in the body, we need to heal it and we need to repair it. So, and it's not, people think it's woo-woo, but the basic science of it is our bodies. I think most people can get on board with the idea that science has shown us all the cells in our body, everything in our body produce a millivoltage. We're electrical beings.
Absolutely.
And Dr. Reich discovered that. And so bioresonance scanning and these other NES, and there's no shortage now, are able to read the millivoltage that our bodies produce, mm-hmm. and then paint a picture for us of what that means. And I'm oversimplifying a lot of that. It's very complex math and science, but that's what's happening. So you go over there, and it's very commonplace to walk into a clinic of some sort and need some diagnosis, and you get some form of bioresonance scanning and a couple other things, maybe some thermography. Oh, okay, here's what we've got going on, and a very extensive interview process about how you're feeling, thinking, all that kind of stuff, mm-hmm. and then employment of any number of brilliant electromedicine type devices,
right.
and natural products to assist the body in doing what it wants to do, which is get into a harmonic alignment, heal itself of its ailments, extract what shouldn't be there, build up what should be there. Mm-hmm. That's what our bodies want to do. And when we can very gently assist it without creating a run-on effect from a synthesized man-made product that goes in, okay, maybe it helps this, but then it causes these other 9 problems, and we end up our tail. These modalities go right to cause and effect of things, and normalize, balance it so that the body can do what it needs to do and carry on.
So what would it take for these physicians to kind of start to embrace this? Because I know that it really took professional athletes for doctors to begin to accept something like acupuncture that has been around for hundreds of years in right. Asian medicine. It took them forever until, again, it was professional athletes that started using it. They're like, and I know that some athletes use acupuncture with electrical stimulation going through the needles as well. So they accepted that, and some sound therapies they'll use because, they had the lithotripter machine. I don't know if you remember, that is what they used to use for kidney stones. They used to dunk you in water, and you were anesthetized and not euthanize, anesthetize, and they put you in a bath of water. Right? Yeah. Well, he's dead. That's it. They it was general anesthesia. And they put you in a tub of water. This is when the lithotripter first came out, and then they would use shock waves to bust up, the stones. And then I guess the lithotripter machine is a lot different. I don't know if they still dunk you in water or anything, but I remember they used to. So they accepted, modalities like that. And it seems like, okay, we're dealing with electrical stimulation. We're dealing with frequency. Even with artificial limbs, it's used and motivated by electrical stimuli. You know what I mean? So
right.
What would it take for them to get more off into this, like the Rife machine, which is, amazing? So what's it going to take? Is it going to take a group of other people to bring some more open-minded physicians in to understand what's going on and let them take it to their other colleagues? Or are they just going to just say, no, you can't give us money from from big pharma. We're not making any side money off of this. It's not about healing you. It's about the cash. I mean, what would it take?
It's an interesting question. I mean, it's from what I've seen so far in my own experience as a survivor and a widower to disease, and the unfortunate thing is the almighty dollar rules everything, particularly in this country. And fear. You've got we were seeing from a clinical standpoint, the positive that I'm seeing is we're seeing more nurses come over.
Yeah.
And because the nurses they're at the front line. They're actually interacting with and caring for people.
Mm-hmm.
And the doctors, we've created a system where you don't really talk to your doctor much. I mean, they come in for 5 minutes,
Yeah.
type some shit on. So they're not really on the front lines anymore. They're not getting to know you and your family and what you're thinking and feeling, what's going on in your life, which is very important in our health.
Right.
Whereas the nurses, they're the ones in there in the hospital and the clinics that are interacting with you, talking to you while they're taking your vitals, administering medicine, doing whatever the doctor wishes. And
Right.
so they're the ones more profoundly seeing, wait a minute, I'm about an outcome here. I'm not making a squillion dollars. I don't have 3 yachts and 6 homes.
Mm-hmm.
I'm interacting with this person and I want an outcome. And the doctors have become so removed, in my opinion, from the care, the actual care
Yeah, I would
of the
agree.
human, that then they're much more susceptible to, hey, licensing. Hey, if you don't do this, we're going to take your license. Even the doctors I talked to, some they kind of do want to do the right thing. They're like, but I still got $250,000 in student loan debt and 6 mortgages, and
Mm-hmm.
a wife with a taste for this or that, or a husband with a taste for this or that, and this lifestyle that big pharma basically provides me.
Yeah,
By administering and prescribing these medicines, and I don't know what to do different. I can't. I'm stuck.
Mm-hmm.
My financial world that I've allowed myself to create dictates that I do it this way because there isn't giant money in what I do. You've seen what I charge.
Oh yeah, absolutely.
I'm not going to be driving around in a Lexus going to my lake house and all that kind of stuff with what I charge it,
Mm-hmm.
and it's not what I do and what a lot of us like you do is not designed to be something that you're hooked on for the rest of your life.
Right.
We want to help you get better and go live your life.
Right.
Maybe come back and do some maintenance stuff, but our medicine model has just gotten into this thing of, I call it genocide for profit, unfortunately. And I what it's going to take, I think, is enough people. In a really broad stroke, what I look at, the center I want to build and everything, is let's create a better mousetrap and allow people to choose that, educate them, and over time, if enough people leave an old model that isn't working for them, they have to adapt or die.
Yeah, and one of the things I've always said, from learning from you, being at Sedona Photon Light, seeing the different modalities, using it on myself, treating, some injuries that I've had. What was I going to say?
Adapt or go away.
Yeah, it's sorry. Yeah, they need to adapt to it, and it's just, I don't know what these physicians are going to end up doing. I really, really don't, because for someone like me that goes in and is able to use this treatment, I may be going off course from my original thought, but to see it work and doctors not want to do anything, it blows me away. I know it's all about the money. I can see something that targets my treatment. I go in, it's not expensive. I come out feeling better. I know I can stop at any time, but the physician, they just don't want to see it, and I don't get that. I'm sure I went away from my original thought. It was like I just zoned for a minute.
Too bad. Maybe it gets to a point where all of a sudden, they end up in they go through financial straits that a lot of other people and a lot of professionals go into. Their model dies. That business model doesn't work anymore, and they're going, shit, I got to reinvent myself. This old model that always worked doesn't work anymore. I got to do something different. And if they genuinely do care about people and making people better, then they will find their way in, and I would love for as an example, when I use more targeted therapy with the GB4000, that's I call that my sniper rifle, and the genius of my shotgun, right? Because I can target with this thing.
Right.
To have a very bright physician with a lot of education, training, and understanding, I would love to have one of those guys look at my frequency list of all the stuff Rife came up with,
Mm-hmm.
and people since then have packaged into channels to be able to deliver several at a time. Look at that like a pharmacy. Instead of looking at a pill list, look at my frequency list. With
Right.
your understanding of the human body and the way it works, look at that list like a pharmacy and go, oh, okay, we need one of these, and we need some of that,
Right.
and some of this, and some of this. They could be very, very effective in this realm in what I do with the training they have, but instead they're using, the pills. And so,
Yeah,
I look forward to the day,
that's like, I know that cancer patients have gone in there, and I remember, and I'll say this too, my mother had cancer, and she had stage 3 colon cancer. She's no longer with us, but I remember she called me up and she said, should I do chemo? Should I do this? Should I do radiation? And we talked about it. And I remember at that time, I wasn't off into alternative medicine, but I remembered a pill for radiation. And I said, why don't you try that first? And she said, okay. So she took one and she didn't like it. And from then on, my cousin just started dosing her with soursop tea. Soursop tea from the leaves in Hawaii. It's you take the leaf and you make soursop tea, not the kind you buy in a can. There's nothing, not processed, nothing. And she went into remission about a year later. And if you Google soursop tea, you will read a lot about it. It's something that is blocked. A lot of physicians don't even want you to know about it, but it has healing capabilities for cancer. And my mother's living proof. So I wonder sometimes, and that took away from money, big money from a cancer patient.
Yep.
I know that some cancer patients have come through your doors. I know some have had treatment success, some have not. And again, no one is, everyone is different. Some people are going to have success. Some people aren't going to. And we all need physicians at some point. That was my thought that I lost, my train of thought that I lost. Yeah. But eventually, we're not saying that you don't need physicians in your life, because, you're not going to have a herbalist operate on your spleen. You know what I mean? So, yeah. Right. So I'm sure some would, but in some countries. But no, they're there for that specialty and for that reason. And if you have different viruses, yes, I could see, going to a physician. I mean, I came back from Sedona to have medical procedures, that I had to have done, scopes and things like that. But yeah, they do need to become open to these things. And, I can understand skepticism and things like that, because when I first walked into Sedona Photon Light and I saw these machines, and this was years ago, and I went in there, it's like, what the hell is this? What is this? Right. Oh, yeah, not even sweating. Okay, boom. Go home, take a shower bath. The only thing I was really recognizing is, damn, what is that smell? It was, I didn't, it was toxins and stuff. But as I've gotten more into this, as I've gotten, and hopefully others will too, when you get into your wellness, when you get into your spirituality, when you begin to put good things in your body, you begin to eat whole foods, not processed. And on a previous show, I had mentioned that if you eat salad from a bag, that's processed food. They had to process that to put it in the bag. But once you start treating yourself right, and I'm not 100% there, I'm not going to stand on, some pedestal and preach, about everything. Because, man, I will eat a Reese's. You know what I mean?
Yeah, but we're all human,
Yeah,
we're to have an experience. But part of the experience.
But if we can start doing that and look at some other treatment modalities, it'll blow your mind. Now, on the Rife frequency sessions, I can't remember the book that I read. I did an audio book about it, but she was absolutely phenomenal, and she talked about her practice. You may know the book and the author, but
are you talking about Carol McMacken?
Absolutely, that's who it is. Yes. And she talked about the Rife frequencies. And so when Bill is talking about a list, he wishes these physicians could look at this list. It is it's an extensive list, and it is amazing what they could do. Like one really got with me was when someone came in and they had this knot on their back. We have those, you normally go to a massage therapist and they sit there and try to get it out, and they don't. But I've got the same thing, but in the book, they just applied 2 different wands or electrodes, and they put them near the knot on the person's back, adjusted the frequency, and it was gone. It released in half an hour. Now, she did say that is not common. Sometimes you need a few sessions, but it is, even though it's not common, it is common. So if physicians could just see things like that, I mean, even in sports industry injuries, they use frequency. They use ultrasound.
In that book, did you read the whole thing?
Yes.
Do you remember the part where he was talking about Terrell Owens?
Yes. Yeah, Terrell was flying her. Yeah, he was flying her, had her on the plane, would fly her to the house, and he had this catastrophic injury. And he was playing again in 6 weeks or something?
Yeah, that was a career-ending injury going into the playoffs when he was playing for the Eagles. That was a career ender, and he played in the Super Bowl.
Yeah,
6 weeks later.
6 weeks later, and that is the technology that we're talking about right now. And Bill actually has that same machine that Terrell's using at Sedona Photon Light. Again, this isn't an infomercial. You know what I mean? Buy now. Enter coupon number 37 Rosie. You know what I mean?
Yeah.
But you'll end up meeting Rosie, everybody. Trust. That's a big that's a big thing coming. Just stay tuned. But yeah. So with the Rife machine and these different frequencies, what do you see the future of it? I mean, it's been around forever. Not forever, but it's been around for years.
Right. Dr. Rife, came up with this in the 20s and 30s. And like I said, it's been around forever. And it had to go very underground after what they did to him and Tesla and Lakowski and another French guy, I forget his name, and many others. And so that's why when Skilling developed his technology, which incidentally, most everything out there that's starting to be accepted in mainstream, red light therapy, blue light therapy, all these different things were based in Ed Skilling's work, which was based in Dr. Rife's work. And
which was based on Tesla, correct?
Well, now Tesla, it was similarity, but they're almost two different lines. They're very, very similar, but Tesla had a propensity down the magnetic resonance side of things.
Okay.
So Rife used electronic stimulation. They're almost identical, but they're just sort of parallel pathways to the same endpoint, which was the affecting of an organism or a cell with electricity or magnetism. So they both accomplished the same kind of thing, just kind of took parallel paths. And so this where I see it going, I mean, I feel personally that had it not been so intentionally squashed and destroyed in the 50s by the AMA, that we wouldn't be sitting here with all the diseases we have, and healthcare wouldn't have turned into what it is.
Right.
Because in it is the ability. You've begun to experience it at a small level. I work with a lot of late stage cancer clients, and I can't unsee the things I've seen or unhave the experiences I've had.
Sure.
And with this kind of technology, I am 100% certain that as it now proliferates, we will see health at a level we've never seen before. We will see a reduction in the contraction of disease, as well as the ability to treat it sooner and more effectively with a better outcome.
Yeah, there are so many people that
these terrible diseases is just horribly low, and people don't recognize how low it really is.
Yeah,
and with this, and with this too is a very important point I wanted to make before we wrap up in a little bit, is that I tell all of my clients, I'm not going to heal you. These machines aren't going to heal you. The natural products I have available are not going to heal you. You're going to do it. I'm just going to assist you on this path of helping identify what resonates with you, get in touch with what's going on as these things are releasing, and understand the emotional components that contributed to you being in this position in the first place.
Right.
But we've been trained to look for that magic pill, that magic machine, that's something outside of ourselves that's going to do it for us and take no responsibility for our own healing.
Yeah, like I was saying, there's several people that I know that I just want to tell them, you need to go to Sedona to check this out, or if you are in Sedona, you should just check it out. Because again, it is a different modality of treatment. Everyone is different. It works on most. I would say I receive benefits from it. Some for me would require me to have more treatment on certain things, but I honestly believe with what Bill is doing there through, the technologies that he has, combined with, proper, nutrition, proper mindset, which is the health, wellness, and the spirituality part of it, combined with this modality of therapy, it could set a tone for a better life, a way to learn to help self-heal as well. Adding some visualization. I've seen people come through the door when I was there that they would come out and they would say, yes, I was doing my visualization, say that, visualization as I was going through the treatment, listening to Indian flutes, and they come out and they're just like, whoa, you know what I mean? I've seen these people come out of their session just like, wow, and they have to sit down, drink some water, because it worked and they were allowing it to work and they were doing self-visualization of it working. And I think, I know that we could all do that if we could all just experience that.
Yeah, absolutely. And, how about the look on people's faces when they come out of the back room from a sound bed?
Oh, yeah. We haven't even talked about the sound lounge. Oh, my God. I remember the first time I ever did that. People, what this is, it is a lounge. It's like a Chase lounge kind of thing. It's leather, but it's a little lounge. Like you're sitting, it's a really nice lounge. And you lay in it and you cover your eyes and you put on some headphones, and then it begins to vibrate with frequency. And it's like, it's insane. You will fall asleep
or go somewhere else.
Yeah. Or you'll go somewhere else. But that is amazing. I've never been told what its purpose is outside of just, chilling the fuck out with sound.
Yeah. So, it was based in Dr. Emoto's work, who was the brilliant Japanese scientist that helped us really understand the consciousness of water, and how the way we treat water,
right,
has an effect on the water. And most of our body is made up of water. So if we treat that water really well and vibrate those cells and that water in a certain way while we're listening to the music, the kinesthetic as well as the auditory, and now we have the visual cortex stimulation with brain tap, it's a game changer that you just can't describe, because you're affecting what we are made up of the most in a positive way. And everybody, like you say, everybody's experience is different, and they come out of there. I need to start videotaping it because you can tell the look on their eyes.
Yeah.
Like, what?
Yeah.
What was that? What the hell was that?
I haven't seen one person walk out of there depressed. They come out of there with smiles and stuff. It's unreal. And then Bill and I were working on some other technology with the bed while we were there. Who was it? Margaret, right? Was it Margaret?
Oh, Meredith.
Meredith. Sorry. She came in. She had an idea to have people on the bed, and she wanted to walk them through a meditation while they were going through this. And I'm like, oh my God. So Bill and I, after trial and error, finally got it right. Yeah. And you can even have you can even do a walkthrough meditation with it.
Meredith will be doing breath work sessions. We've got a microphone and a mixing board, and now while you've got the headphones on, you're experiencing these tracks that she uses to take you through breath work and into another world she can coach through, and it is so
absolutely. Wait till we bring in the keyboards, the guitar, and the bass and the drums.
That's gonna be nuts when we can play somebody, read their energy, and play them.
Yeah.
I don't even know what's going to happen. We're going to people levitating or something.
Absolutely. But anyway, we're going to have. Go ahead, man. Go ahead.
Well, I was going to say, it's a lot of fun, and then people come out like said, wow, what was that? And so much of what happens here in my place and a lot of other places in Sedona, I feel, is, I create space here for people to have the conversations to try to understand what is going on. Because they come out and go, whoa, I just let go of this or that. And want to kind of bounce it off somebody and start to open up and talk about what's coming up for them so that they can, continue to open to what's coming and actually heal it. So much of it is the integrated conversation that happens as a result of these modalities that you're using. And
absolutely.
you can just race into the sauna and race back out and go about your day if you want. But if you hang out and connect with some other people and talk with myself and Daenerys or you, if you're here, whoever, and really, seek to understand what's going on, hear somebody else's story, that's where a lot of magic happens. A lot of magic happens.
There's a lot of go ahead. Yeah, there's a lot of amazing stories there for sure. The people are amazing. It's a warm environment. It's a loving environment for sure. If you're in Sedona, you really need to check it out. And if you have some other, things going on in your life that you feel that it's just not working for you where you're at, you can still reach them. I'm going to give out the number, by the way. It's wherever you are in the world. If you're in Europe or anywhere else, of course, it's 928-641-4342. You can go to SedonaPhotonLight.com. You can see, briefly what they do, some of the packages, about, you can actually book them. If it's a treatment that you're interested in, you'll be able to talk to Bill or Danny. It won't be someone else. Won't be, hello, thank you for calling. It won't be anything like that. You'll actually speak to someone there. They can talk to you more about the treatments, book you, that kind of thing. It is something really to check out. And I believe the future for this modality of therapy is going to explode. More and more people are finding out about it and, how it can better their lives in some way. And you're never going to know until you either try it or you learn more about it. I was never a skeptic. I was just always like, what is this? That kind of thing. And, I support this in a massive way. When I'm in Sedona, a lot of people know that I have a practice out there. My neurolinguistic programming and access bars practice is within the same building. And Bill's going to be on more as well. We're going to have him on talking about a lot of other things as far as the different modalities out there as far as treatments go, and not just what he is offering, but what else is out there? What he and I see in regards to, healthcare, medical physicians, just a bunch of stuff, and the world is shifting. And another form of transparency here, Bill is also one of my partners in Real Live TV. So, yeah. But it's just, what we're talking about now is knowledge that people need. And again, we just barely even scratch the surface on what these modalities have to offer.
Exactly. Yeah, there's so much to know. And I'm constantly diving into my books and audiobooks and talking to brilliant scientists and doctors and people that are out there, kind of under the surface, busting ass to try to, help humanity move forward in a better way and connect with one another.
They offer, Volasta, which is a whole nother show. We're actually going to have Sam Shepard on, who is a PhD scientist who developed Volasta. That thing is off the chain. We have John Ellis Water, which, we'll have John Ellis on. That's a whole nother thing that is offered there. There is so much out there. Yeah. It's not a placebo type of deal, but it's
all this stuff like that, based in really solid science, not pseudoscience, not consensus, actual science, scientific method science.
Yeah. And I think that's the way the world is shifting. And again, in Asia, Southeast Asia, a lot of places in Europe, South Pacific, people are already embracing this. But again, this is America, and it's always the hardest shell to crack because people are cynical and skeptical, and just it's going to take time.
Yeah.
So,
Money thing. That's why medical tourism has gotten so big outside this country. You can go to India, Asia,
yeah.
South America, all these places, and go to these opulent, beautiful facilities and live like a king and have very advanced medical procedures done for and the whole vacation costs you a fraction of what the stupid outpatient thing costs here. You know?
Yeah,
It's
I mean,
nuts.
you know, I know people. We have mutual friends that have gone down to South America, Costa Rica or places like that, to have dental work done, the entire mouth, which would cost 35, 40 grand in the U.S., and they come back, yeah, I spent $5,000. It's like, what?
Yeah, hung out on the beach and went and saw a volcano, had this great vacation, and
the mouth looks fantastic. It's like, where'd you get your teeth?
Yeah, exactly.
So, but yeah. All right, brother. Well, it was a pleasure to have you on. I thank you so very, very much. You know, you're on again, but everyone, I hope you guys learned a little bit about this. And again, if you're interested in any of the therapies that Bill talked about, you know, outside of Europe or wherever, it's 1-928-641-4342. You can email them at info@sedonaphotonlight.com or go to sedonaphotonlight.com. And yeah, man, tell Bill that you heard him on the show.
Thank you. Yeah, thank you very much. I really appreciate it. And people don't hesitate to reach out to me to maybe help finding something close to where you are, or just some information. You know, I'm here to help people heal themselves and live a better life. And you know, that's just what I'm here to do. So don't hesitate to reach out. And in fact, as always, it's been an absolute pleasure. I love you, brother.
Love you too, man. And everyone, there'll be more to come. I appreciate you guys. It sounded like a damn infomercial, and it wasn't. It was just, I think because I was so involved in what we were talking about, and I'm kind of a part of what we were talking about. So it was like an infomercial, but everyone, it wasn't, man. It was the best for you. So on that, man, I hope you guys have an amazing day, an amazing life. Take some time out for yourself and just breathe. Focus on your breath. Yeah. Just breathe in, breathe out. Focus on that for a little bit. Whatever noise comes into you while you're doing that process, recognize it, let it go, and just continue to breathe in, breathe out. Screw what's going on in the world. Turn off the damn news. You don't need to be watching that unless you're watching the weather. And the best way to check out the weather is to pop outside and pop back in. But yeah, man.
Exactly. They're wrong all the time anyway. So just walk outside and look.
I know, right? Whenever they say it's going to rain, it's going to be a beautiful day. So
yeah.
But anyway, you guys take care, buddy. I'll see you soon. Peace.
All right. Thanks.
And aloha.